Good afternoon and welcome to Managing Chronic Pain from Home. My name is Mary Kelly. I'm a nurse practitioner and the Clinical Director of Perioperative Pain Services in the Department of Anesthesiology, Critical Care and Pain Management here at HSS. And with me today is Dr. Faye Rim, who is a board-certified physiatrist, as well as the Medical Director of Pre-Surgical Chronic Pain Management at HSS. Thank you, Dr. Rim, for joining us.
Thank you so much for inviting me.
In this webinar today, we will be discussing chronic pain, how it differs from acute pain, and when to seek care, as well as different treatment options and strategies for managing chronic pain at home, and especially during this COVID pandemic. So Dr. Rim, well, let's get started. So let's start with the basics. When does pain become chronic? How does it differ from acute pain?
So chronic pain by definition is pain that has lasted longer than the expected duration. By and large, any pain that has been around for more than 3 to 6 months is considered chronic. But again, it can depend on the nature of the injury. Some things take longer or shorter to recover from. So anything that really lasts beyond the usual expected recovery time is considered chronic pain.
Okay. And what are the most common types of chronic pain people face?
So most of the chronic pain, I think, are things that people think of naturally. Low back pain, knee pain, sciatica type pain, sometimes neuropathy from diabetes. Even headache is considered a chronic pain condition.
Okay. So these are underlying conditions that manifest in a symptom of pain. What makes some people more susceptible to chronic pain?
So, pain is a symptom. Pain in and of itself is not a diagnosis. And depending on the different diagnoses or the underlying conditions you can have different types of pain. So, if you have diabetes, you're going to be more prone to having, a nerve-related pain from that. If you have rheumatologic disorders like rheumatoid arthritis, obviously you're going to be more predisposed to having knee pain and joint pain. Osteoarthritis is unfortunately a normal part of the aging condition, and a lot of people have, inflammation and chronic pain in the joints as relates to that. So I think first things is kind of looking at your underlying condition and seeing if you're more predisposed to having pain from that. Mm-hmm. The other thing is there are obviously certain lifestyle issues that can come with chronic pain. So, there are more pain conditions associated with being obese or having a sedentary lifestyle. And sometimes, you're born with congenital symptoms or congenital conditions, and that will also mean that you are more likely than not to have a chronic pain condition.
So you mentioned lifestyle. What kind of lifestyle approaches can I take to improve my chronic pain?
So, the bottom line is always kind of diet and exercise and lifestyle modifications. I mentioned obesity is a link to having a chronic pain condition. So, trying to stay within a normal body weight. Again, there's a range, but definitely trying to stay within that range. What you eat in terms of having foods that are high in antioxidants and getting enough fresh fruits and vegetables as opposed to eating a lot of processed foods. Those will all kind of help you have less pain in your overall condition. There are, sometimes vitamins and supplements that are also associated. Vitamin D is central to trying to minimize pain. And then sometimes some of the supplements like fish oil and glucosamine chondroitin also come into play with trying to decrease pain. Exercise is also central to that. The stronger your muscles are, the less pain you can have in your joints because they'll support it better. The more you move, the more blood flow there is, the more the fluid your movements will be, so it can be less painful overall. So, we try to emphasize getting 20 to 30 minutes of exercise per day. Again, you don't have to do it all in one stretch. You can spread it out over the course of a day. So it's 10 minutes here, 10 minutes here. But basically, you want to be able to move your body. We also look at lifestyle modifications. We always have the argument about high heels versus sneakers. Are you sitting around all day? How much do you get up and move around? what kind of mattress that you can have.
Mhm.
There's no hard and fast rules, but again, sometimes some people's preferences come into play. The other things that we can look at is, depending on your workplace environment, and especially with the current pandemic, what are the ergonomics of your current situation? How are you sitting? What kind of support do you have? What kind of chair do you have? Things like that. So, really paying attention to your surroundings and your place within those surroundings will also help.
So we mentioned a lot about exercises, but how about if my exercises aggravate my problems? Is there anything I should avoid before I start an exercise program? What would you
So I
advise?
think with any kind of exercise program, it's a little bit of a catch-22. That being said, if anything causes sharp pain, you should probably not be doing that.
Mhm.
Um, in general, I just recommend walking and trying to walk as much as possible. Again, you don't have to walk miles and miles, but if you can fit in 5 minutes here and there, again, to keep your muscles moving, to get the blood flowing, to get that muscle memory going, and really to kind of not stay in one position too long so you don't get too stiff.
So I'm doing exactly what you advise. I'm dieting, I'm exercising, watching what I eat. I'm going out with my mask on, of course, these days. Um, how much of this pain should I self-manage, and when should I seek further evaluation from a physician?
Well, I think on one level, before you embark on anything in terms of self-managing, you should probably check in with your primary care doctor to make sure that you're addressing all of the issues beforehand. One is, again, there are underlying conditions that predispose you to pain. So making sure that you are appropriately being managed for your diabetes, for instance.
Mhm.
If you have rheumatoid arthritis, that you are on appropriate medications and that you are compliant with those medications, that will help decrease your pain overall. Um, the other issues are, can you take over-the-counter medications? While they're over-the-counter, that doesn't necessarily mean they are completely benign. And in certain people, you shouldn't be taking Tylenol or you shouldn't be taking Advil or Motrin. So is it appropriate for you to be taking those things? Um, so I think on some level, you don't have to see a specialist, but I think you should be checking in with your primary care doctor before you embark on anything. Assuming you have no restrictions on over-the-counter stuff or anything along those lines, then you can use some degree of judgment in terms of how often do you want to take medications like Tylenol or Motrin or Advil. Um, what kind of exercise program that you're going to take. And again, trying to be consistent with that exercise program.
Mhm.
What supplements you may want to take, and utilizing the full range of um, available treatments that you can get when you do it on your own, using ice or heat, using over-the-counter topicals, whether it's things like Aspercreme, Bengay, Tiger Balm, Icy Hot. You can even get a TENS machine over the counter now, which can be helpful. So, again, making sure you touch base with, primary care doctor, making sure there's no contraindications, and then, utilizing some judgment in terms of what's available, and putting that into place for yourself.
In regarding supplements, can you speak a little bit more about that? I know when I go into a store and there's so many supplements all for arthritis, how do we decide? Is that something we should reach out to one of our primary care doctor about?
I would suggest before you do that, you should probably talk to your primary care doctor. Again, supplements and natural products don't necessarily mean that it's better. And it can be very unregulated. So, you have to be careful. And nowadays, there's also a lot going on with regards to CBD oil and how helpful they can be. Again, you kind of want to read the fine print on all of the ingredients. And just because it's considered natural or it's a supplement or you don't need a prescription for it doesn't necessarily always make it safe. Um, that being said, I think the vitamins in general are probably a safe bet. Again, I always recommend patients take vitamin D and calcium because that's good for bone health. And there's been some evidence that show that low vitamin D is associated with chronic pain conditions. There's been some studies that show that glucosamine chondroitin can be effective, and it's not harmful. Fish oil can be effective, and it's a good anti-inflammatory agent. But beyond that, I always say, you should probably check in again with your primary care doctor before you embark on any kind of supplement or medication treatment.
Okay, all right. So I've tried all this, even over the counter and supplements, but I'm still having some chronic pain that just won't go away. At what point should I see a specialist and start exploring other more invasive options, possibly injections or different medications, opiate medications, or surgical interventions? At what point should I say, okay, I need to see some, I need to
I'm
do
going
some.
to address the opiate part. So I think actually, if you checked in with your primary care doctor, you did some of the over-the-counter stuff, you did some of the, like the heat, and you started an exercise regimen, and you're still not getting any better, then you would check back in with your primary care doctor and see if you need to be referred to a specialist. Some primary care doctors are more comfortable than not kind of going to that next level. Other people say, you have to see a specialist at that point. In terms of what you want to get from that specialist, it really depends on the individual. And I would always recommend going more conservative, and then kind of going, and then depending on how you do with the initial conservative therapy, you would go to the more aggressive therapies like injections and surgery. I will say that opiates should probably not be a first-line therapy for most individuals. Number one, there are prescription pain medications that are not opiate medications that should be tried first. There are other prescription anti-inflammatories that might be more beneficial. There are other pain medications like gabapentin, which is a nerve pain medication, or potentially muscle relaxers that are not habit forming that should be tried before you go to opiate medications. And in that line, if the prescription medications don't help, then the injections can be a next option. And then obviously, if those don't help, then surgery is always an option. And again, I would almost posit that, you could try surgery even before opiate medications, or, the opiates are a bridge to getting surgery, and opiates in general should be very short term, and should not be indicated for chronic use unless you've exhausted all other possibilities, and that includes surgery. And again, when you get into these timelines and when you decide what to do is going to be individualized. So for some people, you're going to ramp through those treatments a lot quicker than somebody who's going to want to hold off and kind of stay in a more conservative approach for a longer period of time. You have to weigh the risks and the benefits from each treatment option. And again, it's going to be different for each individual. And it's a pain condition as well.
Correct. I think it's a quality of life decision for each individual as well. Some people, we go a lot with pain scores here, but everybody's pain score is different. It's your quality of life and your activity and what you can tolerate. So what are the safest medications available for me to manage my pain if I wanted to go a medication route?
So
how can I do dependence?
So the safety, again, is going to be dependent on the individual, right? So part of it is what's your overall medical condition? How healthy are you? What's your kidney function like? What's your liver function like? What other medications do you take? So it varies individual to individual. Most of the time, our first-line therapies are going to be things like Tylenol or acetaminophen. And anti-inflammatories, both over the counter and then prescription. And then things like I mentioned before, depending on the pain condition, you may need a nerve pain medication like gabapentin or Lyrica. You can try a muscle relaxant, and there are a myriad of those types of medications as well. You can use them in conjunction with supplements. You can use them in conjunction with injections. The injections, again, depend on where the painful condition is. I think the most common that people do are corticosteroid injections. That's been kind of an issue with this current pandemic. A lot of people were trying to avoid steroids. And I think that's probably a logistical one for now, just because it's also hard to get people in to do injections. Um, there are also, what's called regenerative medicine techniques. They inject, plasma, platelets, stem cells, things like that. There's less evidence as to how effective those things are, but they may be better or technically less destructive to the joint than maybe corticosteroids are. They obviously don't have the issues in terms of how it affects your immune system. And with the current respiratory pandemic, there's been some issues with that. But how effective they are, I think the jury's still a little bit out on that.
Okay, good point. So speaking of pandemic and COVID that we're dealing with right now, what's the best way for me to seek medical care? It's difficult to go to a doctor's office. What's your take on telehealth?
So I think one of the benefits of this pandemic has been that almost everybody on the medical side has really taken up the mantle of telehealth or virtual visits. So I think that, the first thing you can do is obviously call your primary care doctor or your medical specialist. And almost all of them have some kind of telehealth availability. And is more willing now than before to definitely manage you virtually. Some things can't be done virtually, some things can, and I think the goal is, number one, to try to see how much you can do under the guidance of a medical specialist virtually. And then, there are now in-person visits being done. So, if you need to move into that phase where you need to be physically seen, especially if maybe you're a potential for candidate for an injection or surgery, then, you can make that next step logistically without having to go about coming to the hospital or going to a clinic, and exposing yourself if you don't want to.
Okay. So we talked a lot about orthopedic pain today, but there's different types of pain, lower back pain, headaches. I was just, we're live, so if anyone has the audience has any questions, please feel free to type them in and let us know. Anything we need to add about seeking pain online?
So the other thing I think I want to mention that I probably haven't mentioned already. So one of the things I want to mention that I haven't already mentioned is some of the mental health aspects with dealing with chronic pain. And I think that cannot be ignored. There's a lot of depression, anxiety, and fear that is associated with chronic pain. And so part of dealing with chronic pain is not just the physical aspects, but the mental aspects, because you don't want the fear of pain to limit you from doing exercises and seeking medical care and really moving towards treatment options that will positively impact your quality of life.
There's definitely a lot of stress on the world right now. How about using meditation? Or is there anything else for us to relieve stress?
So there are some studies that definitely show a positive association with that kind of like mind over matter aspect. It doesn't eliminate pain, but it definitely brings it down a couple of notches and it makes it a little bit more manageable. So utilizing, so a lot of the studies are more on cognitive behavioral therapy, but definitely meditation, relaxation techniques are definitely helpful. And I think the other benefit of this pandemic is that has been that there's a lot of apps and technology that is coming into this space. And a lot of that has been made available to the public. So things like, Talkspace, Headspace, the Calm app, the Journey meditation app, those are all available. And I think they all have like free trials. And I think that they can be extremely beneficial to trying to help manage chronic pain.
Okay, thank you very much. So I think we've covered quite a bit in regard managing chronic pain at home. Using diet, exercise as much as we can. Now that the weather is a little warmer, we can go outside, but make sure we're protected and wear our masks. Diet modification and utilizing tools to help us relax as well, different apps like Headspace and Calm. And of course, we want to do all this under the guidance of our medical provider, our primary care doctor. Anything else you would like to add?
I think the issue about managing chronic pain is that it's really managing it. Once you get into that chronic pain diagnosis, it's very hard to get you to a point where you're not going to have pain. It's a question of getting you to a point where the pain is tolerable and getting to a point where you are functional and you can maximize your quality of life within that realm of pain. And there is no magic bullet. There's no one thing that's going to cure you. So the goal is to really have, multiple things that you are doing and utilizing on a daily basis, so that it makes it so that you can maximize your quality of life.
Okay, well, that's great. Thank you so much, Dr. Rim. And that's all that we have time for today. Thank you everyone for tuning in. And if you have any questions, please feel free to comment and or to visit us at hss.edu/feelbetter. Thank you.